Hey everyone, my name is Seth Goldsmith. I'm the Director of Short-Term Missions for Imani Milele Children, and we're here at Mission Uganda 2017. Things are going really well. It's day 3. And we're here at the registration line. All these people have been lined up here. It's been a steady line all day, since even before our American team has gotten here. The Ugandans have gotten earlier. They've gotten here to get things registered and warmed up. What they do here is they register, they give some information about their family, their health, then they proceed onto this tent that you'll see in a minute. The tent, they will wait there until their name is called, and then they'll go see a doctor. So we're going to show you more in just a minute. Everyone in this tent has been registered. They're waiting to hear their name called over the PA system. Once their name has been called over the PA system, they may proceed to dentistry or perhaps adult medical or pediatric medical as well. Well, we're about to take you into dental next, so we'll see you there. Dental clinic set up in the school here at Chitongo, and people will wait along this wall here. Not sure if you can see it there. They'll wait there to be called by the dentist. Also, while they're here, they'll be given instructions about dental hygiene, as well as what to do after an extraction if that happens to be the case. Over here in this chair on your right, you'll see you don't want to be there. That's the extraction chair. On the left-hand side is where they fill the cavities. So it's not just extraction here in the dental clinic. We're actually doing fillings as well. So promoting good dental health is important to overall health, and that's what they're teaching them and promoting right here. After they've received their care, they'll come to this desk right here where they will receive a toothbrush, toothpaste, which has been brought by the team. Thank you for those who've donated. And also they may receive some antibiotic if they've had an extraction to make sure everything is good. From here, they may also be sent to pharmacy if there's something they don't have here. We're here in adult medical, and here in adult medical they've come from registration usually to adult medical, and we'll go through this triage line here in order to get their vitals checked. They'll check for blood pressure, temperature, pulse rate, and the oxygen levels in their bloodstream. From there, they will sit in this queue right here and wait to see a doctor. We currently have 3 doctors working right now. We also have a nurse station in the back. If the doctor decides that an ear needs cleansed or rinsed, what they'll do is they'll take them over there to the nurse station. We also do wound care over there. And they will clean out the ears, get everything out of there that doesn't need to be there. and bring them to good health in that way. From here, the doctors will actually diagnose them and prescribe medication, or they might send them over to the lab. If they send them to the lab, they come back and then to the pharmacy, based on what diagnosis they've found. Found us here in the lab, and we are testing people for lots of different things so that we can give them better treatment. I have a list here so that I don't forget anything. We test for malaria, a lot of malaria out here. Children die of malaria here in Uganda. And also we have complete urinalysis, stool analysis, we test for hepatitis B, we test for hemoglobin levels, we test for blood sugar, glucose testing, HIV testing, as well as education. We also have the Brucella test. So what we do is once the doctors send them here to the laboratory, the lab techs acquire the proper samples, and then they're sent back out to wait. After they get the lab results, they will then proceed back to the doctor, where the doctor will prescribe based on those lab results and send them to the pharmacy. Alright, you found us in the Pediatric Medical Clinic, and this is a very, very busy clinic that we have here. We have more children than any other age patient here. So if you're 18 and under, or 17 and under, this is where you end up. First they come in, they go to Beatrice there, a nurse at the door. She will understand their symptoms in Uganda and make sure she translates them to English because we have some American doctors here that are working. Then it will be triaged here. We'll go and look for the blood pressure, the temperature, the pulse, the oxygen levels in the blood, and also the weight to make sure that the doctors can prescribe the proper dosage of medication. From there, they'll go to this queue that you see right here, children. They'll wait to be seen by a doctor. We currently have 3 doctors working, and after they've been seen, they've been diagnosed, the doctor may send them to lab for further diagnosis to see what prescription they'll prescribe, or they will go ahead and prescribe right away based on the symptoms that they're seeing in front of them. So from here, they will either go to pharmacy, or they will go to the lab and perhaps come back to receive their prescription. Alright, also in our pediatric medical building is ICU, we call it intensive care unit, because this is where we do all of our injections as well as our IV treatment. So after the doctor has prescribed that prognosis, or that prescription, they will then come here and wait in this queue to be given their injections or their IV treatment. We also have behind this curtain, we won't show for privacy reasons, some few patients that are receiving IVs. By the end of the day, sometimes, because this setting is so small and we have so many people coming through, we have people sitting in chairs with IVs tied to the bars on the window. That's just, we do what we can here in Chitongo to get the patients seen and make sure they're in great health before leaving. By now, the patients that are lining up outside have already received their prescriptions from the doctor. They may have gone to the lab and then come back to the doctor to be prescribed these medications. They line up in a long line outside, but the long line is very quickly moved forward as our pharmacists get what they need from these boxes and tables here. All of the medicine here that's needed to get these people well is right here in our pharmacy in Chitongo. In fact, I believe that our pharmacists here actually work a lot quicker than my pharmacist back home. Hope she's not watching. It's very crowded out here in the line. I'm hanging out with Paul here, baby Paul. And we're here in the line for optical and general surgery. Inside, behind this door, all these people have already seen the doctor, and these patients are actually waiting for things, simple things that we can do here in the village clinic. For general surgery would be hernias, hydroceles, some of those things, simple things that can be completed right here in Chitongo without having any resources necessary in order to make these patients well again. And in optical, we've received some glasses from donors back in the US. So as the eye doctor gets a good idea of what prescription is needed for the patient, they will go home from here seeing better than they ever have seen before. Earlier this week, Florence came to our clinic with complaints of blindness in both eyes. She was completely blind in the one eye and only could see light in the other eye. Now, after her cataract surgery, right in this room here, she can see clearly through both eyes. She was stopping us just yesterday, thanking us and praising God that she's received her sight. Many more stories just like Florence are happening right here inside the eye surgery clinic, and we're so grateful to be able to provide this service to the people of Chitongo.